afternoon to everyone. Hi, this is Satakshi this side from Human Biological Institute, and I welcome you to yet another engaging session of our scientific forum. We Talk, Do You? Greetings from Human Biological Institute. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one of its kind platform that is Puberty to Menopause. These session features leading experts from across the country who share their valuable insights on key health topics aimed to raise awareness and promote health well-being of society at large. Today, we are delighted to Dr. Shanthi with us to share her expert perspective on male fertility, myths, facts, and treatment options. I shall be sharing more about our today's speaker in a short while. For a moment, please allow me to share a brief introduction of our company that is Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited. IIL was established in 1982 by National Dairy Development Board, that is NDDB, as one of its unit and was later incorporated as a company in 1999. HBI was found in 1998 when the Government of India requested IIL to produce a modern tissue culture anti rabies vaccine to phase out unsafe nerve tissue vaccines, that is NTV. Our first manufacturing facility was set up in Ooty. This facility is one of its kind in India, rolled out the country first varicella culture rabies vaccine in year 2000. Today, we are a leader in ARV, that is anti-rabies vaccine segment, with presence in around 60 countries. HBI has launched several other vaccines and become a major player in human vaccine segments. HBI has been a keen supplier of pentavalent vaccine to the government of India under its universal immunization program, that is UIP. In yet another milestone, HBI introduced Havishar in 2024, India's first indigenous hepatitis A vaccine aimed at providing protection for both children and adults. So, with the vision of shaping global healthcare by spread heading the One Health initiative, we are committed to providing lives affordable, high quality product through continuous technical innovations. As a market leader, we have taken a significant burden by 160 tons per annum through the introduction of eco-friendly packaging of our flagship brand that is Abhirap. As a part of our corporate social responsibility initiative, we have adopted schools where IIL provides infrastructure support, basic facilities, including association with NDDB through the gift milk program. Hundreds of school-going children benefit from daily milk nutrition. We also have donated an oxygenation plant to Telangana Institute of Medicine, commonly known as TIMS. You know, also, there are some few highlights about IIL. For more information, please visit our website at www.indieimmune.com. So, puberty to menopause is one of its unique initiative where we address a wide range of topics related to women's health and well-being. Welcome to today's episode of We Talk Do You. This session is dedicated to highly significant and overlooked topic that is male infertility, myths, facts, and treatment option. After uh, To help us better understand this condition and its impact, we are joined today by Dr. E. Shanthi. We will short video of Dr. E. Shanthi will introduce you to her. We are honored to welcome Dr. E. Shanti, a distinguished medical professional with a strong background in reproductive health and embryology. Dr. E. Shanti holds her M.B.B.S degree from prestigious Madras Medical College, Chennai, and has further specialized with the postgraduate diploma in clinical embryology from Chettinad Hospital and Research Institute, Chennai. She currently practices at SG Speciality Clinic and Esha Wellness Center LLP and is also associated with Unitas Multi-Speciality Hospital of Dhanwant Integrated Hospital Private Limited. With a deep commitment to patient care, to infertility treatments, and women's, we are delighted to have her join for today's P2M live talk.
Hello, good evening. Thank
Very good
you,
evening,
Human
very good evening,
Biologists.
ma'am.
Yeah. And Satakshi, thank you for the opportunity for this interactive session. Yeah, we can go ahead.
Most welcome, ma'am. We are highly, uh, yes, ma'am. Most welcome you on this platform to help and for the awareness of the society. We need to discuss on this topic, which is rarely discussed in today's world. So, ma'am, thank you for joining us today. And we would like to begin
Yeah,
the session
it's my pleasure.
uh, with some commonly asked questions for the topic.
Yeah,
And, ma'am, my first question to you is what defines the male fertility and how it is diagnosed?
yeah. Actually, male fertility is, I mean, as per definition, it's like the male's probability to reproduce, his ability to reproduce along with the help of his partner, that is a fertile partner. That is the main definition that is given. But nowadays, like there are a lot of issues, so people come to us whenever there is a issue, when they don't get pregnant within a year's time of their marriage or something like that. So the diagnosis is done starting from the history physical examination of male, and then we go ahead with the semen analysis to check whether his sperm count and other things are normal. And sometimes it might lead on to other investigations like ultrasound, of the private parts of a male, and if needed, then we go for the genetic testing also. So these are the procedures that are followed for the diagnosis as such. But it depends, like when they come and the time of marriage and the age of marriage also. Nowadays people get married little late, so we generally want the people to get things addressed little earlier when they get married little late.
Yes, ma'am. Thank you so much for that answer. Can't agree more that we should regard that age factor in the marriage, and nowadays people are ignoring that age factor in terms of marriage and reproduction issues.
Yeah.
So, thank you so much for giving me the answer of this question, ma'am. My next question to you is what age does male fertility typically begin or decline, and why?
Yeah, generally what happens is like not like females where we have a cutoff or something like that, where we have a menopause. For males it starts declining maybe somewhere around 40 years or so. But the thing is, males have the ability to I mean produce sperms even till late into their 80s also. You can hear several males they are having a child even when they are 70s or 80s also. You would have come across in newspapers. But the thing is, generally starts declining due to several reasons, like the hormonal imbalances set in similar to females. They too have some hormonal imbalances during a later ages, like after around 35 or 40 years. And very frequently we come across like metabolic diseases, which are the most commonest diseases of our country, like diabetes, hypertension, and other fatty liver and other problems. Even they contribute to this fertility decline as they age. So aging is a main factor, but the comorbidities and the hormonal factors fall in actually. That's it.
Yes, ma'am. So we can say that after the age of 40, men should be more aware and more
Yeah, exactly. Actually, we my general thing is opinion is we should start seeing our male children also like our female children, because parents care about their female children when they don't attend menarche or they don't develop breasts, something like that. They are a little worried and they take the child to the doctor. But whereas the things that we come across, when we look at the male infertility patients, they are not monitored during their childhood also.
Yes.
Sometimes their infections like mumps or something like that would have affected their testes, which would have gone unnoticed, and the child after growing up, after getting married, when they come to us, it becomes a big issue because that becomes irreversible for us. That is the issue. So we should start looking at our male children also little early in life, and the children also, as they grow up, whenever they have an issue, they should be open enough to talk to their parents and also to the family physicians. Then physicians can direct them to the fertility specialists. That would be the best choice.
Yes, ma'am, very rightly said. As you have said, that men's are often ignored since childhood, as the atmosphere and like surroundings in which we have grown up are made up like that. That
Yeah,
men can't have that fertility issue. But you have rightly said, ma'am. I can't agree with you more on this.
thank you.
So, ma'am, my next question is: can puberty-related hormonal changes affect future fertility in men's, or true that men can have children any age without fertility issue?
No, men can have children even in later in their life, like after 40 also. But it doesn't mean that they cannot have fertility issue at all. Definitely, the hormones that play a role in their pubertal age, Definitely, they have a lot of impact on their male fertility, because we see children who have not had their secondary sexual characters, which have not developed at proper age, or they have got a little, the secondary sexual characters would have developed, like cracking of the voice and the hair growth and other things would have happened little late in their life. Those children can have the impact of the hormonal disturbances that had happened during the pubertal age, and this can have an impact on the sperm quality, that is both the concentration, the quantity, the quality of the motility, everything, the morphology, everything. So it is always, it does have have an impact. Maybe it can be said other way around also. Maybe children who have hormonal imbalances have their pubertal symptoms coming up little later in their age, so
Yes.
that can have an impact on their fertility.
Yes, ma'am. So that means that again, that same point we have to repeat, that we need to think and we need to be as well. So we can't ignore, and we can't
Exactly, that is
defocus
what
on
I told
the.
you. Yeah.
Yes, ma'am.
Yeah, that's
True,
what I
true,
told
true.
you. Like, we have to
Yes,
care
ma'am.
about our children and boys who are in the pubertal age, as we care about our female children also. So that would be better, and it
True,
will give
ma'am.
an opportunity for the males also to know about the sexuality and the related diseases and the problems at an younger age, which can help them to have a better outlook at their sexuality and their behavior towards their peer group and the opposite sex also. So it is better that they come into the they
Yes.
are brought their doctors little early in life.
Yes, ma'am. I'm sure the audiences, the viewers who are watching and who are in their adolescence age must be hearing to you, and they should be now be
Mm.
more aware with
Yeah,
the facts you are representing here. So, thank you, ma'am. Again, my next
yeah.
question to you is, how does male fertility compare to female fertility across the lifespan?
Yeah, as I said before, like female fertility has stopped somewhere, like somewhere around 40 to 50 years. We females slowly start producing a very less number of oocytes, and one point of time we stop producing at all. So there is a full stop
Yes.
at some time of their age between 40 to 50 years. Whereas for men, it can go on, but still, as I told you before, we cannot take that for granted for everybody because of the lifestyle diseases that are creeping in nowadays. Most men after around 35 years or 40 years come to us with a lot of lifestyle diseases like diabetes or pre-diabetic stages, or their cholesterol levels are little high, and their blockages, when the cholesterols are high, they have the blockages of the arteries, which can lead to erectile dysfunction. All these problems are coming in at that point of time, so it is there. Compared to females, there is no full stop as such, but the decline is ongoing, so you have to be careful.
Yes, ma'am. Correct. Correct, ma'am. This reminds me of the another question I have to ask you is that it's a kind of myths and fact related question which I want to ask to you, that can a man be normal with the normal sexual function and still be infertile?
Yeah, sure, definitely. Many men come to us with normal sexual function only. Like only after they are not able to conceive, even after their normal sexual function, with after for around 1 year or 2 years only, they generally walk in and then tell us that we are unable to conceive with 1 year or 2 years of unprotected sex. So that
Mhm.
happens, especially in males who have obstructive diseases, where the sperms that are produced in the testes are not carried out through their vas deferens, and and they are unable to ejaculate it out. In those conditions they have that problem. And otherwise also, people with the normal hormonal balances, like they will have everything normal, the hormones will be normal, their sperm quality will be normal, everything will be normal, and they will have good sexual function also, still they'll be infertile. There can be infertility, some sort of infertility, where it can be unexplained infertility, or sometimes it can be, there can be some hormonal differences which can cause the problem. And a few cases there can be obstruction, which has to be evaluated.
Yes, ma'am. So it's my suggestion to all the viewers who are in their fertility age or who are trying to conceive, with this awareness program, with this live talk. If you are watching us, please go and consult your doctor, that they can help you as soon as possible in this case. So it's eye-opening
It's
session
not
for
that it's something like a threat or something. Maybe
yeah.
like they should have the knowledge. What happens is, we would be happy if people, instead of going for all these pre-wedding shoot and other things, they come to us for some amount of knowledge about their sexuality and I mean childbirth and other things, at least before getting married. That would
Yes.
help them and the partner also a little. I mean, because in our country there is still that partner is getting all the what to say, the every time the partner is only like branded, like she is responsible for
Yeah.
for
True.
the fertility.
True.
Okay.
True. True.
This is happening in still in our country, though it was due to several other reasons from time immemorial. Now, even now, it is continuing. We see many families which they have lot of interpersonal problems because of this issue. They
Yes.
don't understand that the problem can be on the male also. Because
Yes.
if there are somewhere around 100 couples without a child, in that 40% will be somewhere on the female side, the problem will be on the female side,
Mm.
and
Yes.
40% will be on the male side. The balance will be only, I mean, combined together. So you
Yes.
have to understand, and first of all, the male should understand that the problem is with me. Even
Mm.
now, like even 2 months before also, I had a couple where the male doesn't want to come to the clinic at all.
True.
What he says is, okay, I'm okay, so I go get treated and come back. So this kind of thing should change actually.
Yes, I'm just wondering, you might be facing lots of cases in your day-to-day life, and still, at that time, what might be going in your mind, that we as a company, we as a country, we represent India as one of the, growing uh, country, but this thing is still a taboo. That
Yeah, that's why I'm advocating, like whenever they come for counseling, I always advise them to come as couple.
yes,
Okay, it is better they understand that the problem lies with both of them, or it can be either of them. Even if it's a female problem, the male should be able to take it in a good perspective, so that he can, okay, help her to overcome whatever issue she's facing.
yes,
That is the most important thing that they have to understand. Even to build up that, we have to have the children as such, the boys as such coming to us.
yeah.
Like the parents should be the people who has to. talk to the boys or the children, and then they have to tell them that this is normal and this can happen in your future. So we have to visit your doctor at least once in a while, or yearly checkup, and then before marriage also we will go for a checkup. These things have to stem from the parents mind, I think.
Yes.
So it has to be addressed
Yes.
in our
Yes.
country, because still we are seeing this taboo
Hmm.
on the women.
Agreed, ma'am. Agreed. So we need to spread that knowledge of infertility and the issues related to it. Only then in future that
Yeah, definitely.
obligations and everything will be removed.
Yeah.
So, ma'am, my next question to you again is, if a man has a child before, does that mean he is always fertile?
No, he can have we do see such patients also. They would have had a child around 6 years or 7 years, but inability to conceive. They can have certain issues, like even some infections could have caused infertility for them, or there can be some hormonal changes that could have been happening in their body, which could have caused the problem, or some metabolic diseases which they have developed in between, which could be affecting their fertility potential later in life. So all these things can have a problem, and we see some people having like some injury, or some infection affecting their testes, leading on to this problem. So in between they can have infertility, or there can be issue on in their fertility potential actually. So it doesn't mean that okay, once the man has fathered a child, he can remain the same way throughout his life. There can be changes which we have to evaluate.
Yes, ma'am. Yes, ma'am. Rightly said, ma'am. So, ma'am, do you think that smoking, alcohol, and obesity can impact the sperm quality and fertility of the male?
Yeah, many males with these habits of smoking, alcoholism, or obesity, they come with the problem of infertility. The issue is like all these three can affect the sperm parameters. Though smoking can affect the sperm parameters in a way, like it directly affects the DNA of the male. Actually, the DNA fragmentation, the DNA is
Okay.
main part which is helpful for the progeny. So that is affected in case of smoking. But what happens is, like everybody asks, like every smoker doesn't without a child. So why do you advocate no smoking? This is the question that
Mm.
people ask when we tell them.
Yes. Yes.
The thing is,
Yes.
it's like a common practice only. For example, you can eat paneer or something like that easily without any issue, but another person
Mm.
may not be able to take
Yes.
that. Okay, he or
Correct.
she can be allergic to that. So it is
Huh.
similar to that only, like every body reacts to the issues in a different way.
Different
Like
way.
a smoker who a continuous or chain smoker can have children immediately, also immediately after marriage.
Mm.
Whereas a person who's smoking even for 2 or 3 cigarettes per day or something like that can have an impact. These are all dependent on the bodily response to the factors which are there in the environment and our habits also.
True.
So it will be affecting actually,
Yes.
especially the in alcoholism. It affects the motility and the morphology of the sperms. So it has to be maybe taken in moderation or something like that. But we have to see what where they stand once we do the examination and other things. If the problem is very severe, for
Yes.
example, they have a very severe problem in their sperm quality and quantity, then we generally advise them to go on quitting their habits only.
Yes.
So
Yes. Agreed.
can be there.
Yes, ma'am.
Yeah,
Definitely, if they are planning to have a baby or something, but they are habituated to alcohol and something, as you have suggested, they should be more conscious about their habits and then they should think about the outcomes it
yeah.
might cause in their fertility health. So, definitely, ma'am, thank you so much for answering this question in such a good manner. And we have a question, ma'am, on the screen. Is hydrosalpinix curable through medicine and yoga and food habits?
Yeah, hydrosalpinx is concerned with females actually. So you, yeah, like the hydrosalpinx cause can be to several issues. It has to be evaluated by the gynecologist.
Yes,
Sometimes it gets cured after a couple of cycles of medication also. But for some people, there can be other issues which will not help hydrosalpinx to be cured with medication. In that case, they will assess the patient and then they will give some options. There are options to do a clipping of the, I mean, what to say, the tubes or something like that. So that will be decided by the doctor who is treating the patient actually.
okay, ma'am. Okay. I hope Jivitam has got the answer. Thank you, Jivitam, for the question. And my next question to you, ma'am, is what role does stress play in male fertility and how it can be managed?
Yeah, actually, what happens is when you're stressed for any reason, for anything that for the matter, your stress hormones go up. Usually, the stress hormones have a inversely proportional relationship with the testosterone, which is the male hormone actually. So what happens is whenever the stress hormones are high, the male hormones come down, which in turn can affect the spermatogenesis, that is the formation of the sperms and their development, the maturity, everything, and the motility. All these things are affected. So what we have to do is learn to de-stress one way, or at least do some exercise, meditation, or yoga she suggested, to bring down your stress level. And the thing is, what I we usually advise is like everywhere there is stress nowadays. There is nothing called okay, it's stress free. Every
Yes,
job, every small thing in the life is becoming stressful for everybody, because most of them are working on some target or something like that. It can be
yes,
financial target, it can be some office target or something like that. So you have to understand that all these things are going to go, like it's like a river, you cannot touch the same place twice. Okay, it's going to be flowing and it is going to be there throughout your life, but that doesn't mean that you
yes,
have to get stressed out for everything. Okay, you have to learn to live with stress, or you have to just learn to de-stress yourself even in stressful situations. These are the most important things,
yes,
so that your hormones are not affected because of your stress.
yes, ma'am.
Yeah.
Correct. Rightly said, ma'am. So, my next question to you is, ma'am, can exposure to environmental toxins like pesticides or radiation can affect the fertility of male?
Yeah, definitely. Especially the fertility. Fertility is affected very much, in people using pesticides, insecticides, and other things. That it is because some of the insecticides and pesticides are like endocrine disruptors. They disrupt the endocrine metabolism actually. So what
Okay.
happens is, like instead of your testosterone going up, especially in males, your estrogens can go up, which will be there in the body of the males also. So what happens
Yes,
is,
yes,
it will affect the quality of the sperms which are formed actually. So it
yes,
is
yes.
better the people who are exposed to all these things, especially the farmers. I had a couple who had come to me nearly after around 7 years, I think 7 years after marriage. they were not able to have a child of their own. And when I learned the profession, he was a farmer using lot of pesticides and other things during farming. So we changed the whole thing for him. We changed everything to natural manure, natural thing. And
Mhm.
I think within couple of 6 months or 7 months, they conceived on their own. I mean, they didn't require much of treatment as actually.
Mhm.
So
Yes.
things can happen. Similarly, what happens is, as I told you, like for this thing, smoking or anything, it all depends on the human body also. Each person responds to the toxins or anything in a different way.
True.
So never think it's a blanket treatment or blanket solution for anything. So you have to assess. Everything is done on individual basis only, and then we have to treat them. This is more important. So what happens is, many people like Google search on several things, and whatever comes up they start taking, and then they come to us, which may not be the right method of
Mm.
treatment or something like that. And
Yes.
especially people who are exposed to toxins, they have this they have this oxidative stress due to uh, reactive oxygen species radicals release actually. So this can cause lot of cell death and
Mhm.
apoptosis, which can be harmful for them. So we have to be very careful while using all these pesticides and other things. Similarly, in radiation, ionic radiation, which are given during chemotherapy, I mean, which are given during radiotherapy, when they cover the normal cells also, they can affect the cells actually. Though they cure the
Yes.
damaged ones, they can affect the normal ones. So nowadays there are methodologies. Nowadays there are good methodologies there, where they are giving flash therapies in radiotherapy
Okay.
also. So the exposure is limited and the rate is high, so that they get treated well also. So you have to find out what kind of radiation you're going through, and whether your body will be affected, or it will be better that you go for a cement freezing or something like that when you have some issue related to your related to your either genitalia or any other organ in that area, which
Mhm.
needs cancer treatment, radiation, all these things. So you have to think of it. So this is one thing. And related to radiation, especially, the things are the discussions are more about the Wi-Fi, phones,
Mhm.
mobiles, and then laptops and other things.
Yes.
So part of this radiation, there is always a debate going on, where one side tells that okay, there is not much of radiation effect for while using all these things. There is another thing where debate where they tell that it is not affecting much, so you don't have to worry about it. But what I would suggest is, this is my personal thing, but I would suggest is, like, we know that there it is little bit harmful.
Yes.
So you have to have a judicious use of all these things.
Yes.
Maybe you don't have to keep your Wi-Fi inside
Mm.
your bedroom or where you sleep, and your mobiles can be kept, and your laptops, you
Yes.
don't have to work with the laptops on your lap or something like that. You can have a proper desk or something like that. And
Yes.
don't put your all these androids and other things close to your heart, close to your genital area. All these things, judicious use, I think, we can mitigate some amount of harmful effects of these.
Correct.
Yeah.
Correct, ma'am. These are some small tips we can follow in our daily life so that we can be, be prevented with the ultimate negative thing of the radiations and the thing which it might cause. So yes, ma'am, we as a people, not just male but also females, should follow this, I
Yeah,
feel.
and one
Yes.
more thing I want to tell is like most of them are using their mobiles only during the bedtime,
Yes.
which we ask them to avoid because this we have our circadian rhythm of our body where
Yes.
this body rate needs like rest for around 7 to 8 hours. This is inbuilt. Okay,
Yes.
we are spoiling that body by way of looking at our mobiles in the middle of the night and then doing everything on that hour or something like that. So
Yes,
it
ma'am.
is better you disconnect from all these things and then go to sleep so that your body gets regenerated and your pineal gland works well, get good amount of melatonin. So all these things are helpful for your total well-being also.
Yes, ma'am. Agreed. Agreed, ma'am. Yes, definitely we should focus more on our sleep cycle, and so that we can work for the whole day with a fresh mind and a fresh
Yeah.
body and with a good health. So definitely we should start doing the small changes for our day-to-day life. Thank you so much for this all small suggestions which we can induce in our day-to-day life, ma'am.
Yeah,
Thank
sure.
you.
Thank
My
you.
next question to you, ma'am, is what is azoospermia and how it is treated?
Yeah, azoospermia is a condition where we are unable to find any sperm, even a single sperm, in a male
Okay.
semen sample, either through like just looking at the normal sample, or what we do is we centrifuge that and take the pellet, like whatever comes as a small pellet underneath of after the centrifugation, and then we screen the whole pellet, okay, slowly and thoroughly, because there is a condition called cryptozoospermia where we will be able to find at least one or two sperms when we screen that way. In azoospermia, we will not be able to find even one sperm. This is called
Okay.
azoospermia, and it can be of two varieties. One is due to blockage in the pathway. As I said before, like it can be like the sperms could be formed, or a spermatogenesis is happening inside the testicles normally, but the pathway which through which it has to come out can be blocked somewhere. So, or it can be, there can be a condition called total absence of vas deferens, which carries the sperms from the testis to the thing in a condition called cystic fibrosis. So, this is obstruction. And another condition is non obstructive azoospermia. It can be due to several reasons like infections or hormonal imbalances or genetic conditions like Kalman syndrome or Klinefelter syndrome. All these are the syndromes which can affect the males. And there is a condition where there is a condition called Y microdeletion, where there is a deletion of certain parts in the microsome, which can cause to azoospermia. So this is called azoospermia.
Okay. Okay, ma'am. Thank you for the answer. Ma'am, my next question to you is uh, how the male infertility diagnosed and what are the tests that is typically done?
So when the male comes to us when the couple come to us for infertility, usually what happens is both the male and the female partner are evaluated. The basic evaluation is done first, and for a male the basic evaluation is first history taking. We have to take a proper history of everything, like including their coital frequency and other things, because there itself can be a problem. The couple would be having intercourse once in a while, like weekly once or something like that, which will not be sufficient for achieving a pregnancy. Mm,
Yes.
they should be able to have an intercourse or coitus at least once in 48 hours or 72 hours, which will help them to become pregnant earlier. Okay, that frequency would have not been followed. So we have to start from the history. And second thing is we have to go for the general examination of the male, including the genitalia, because small issues can happen. There is a condition called hypospadias also, where the urethra, that is through meatus through which the sperm
Mhm.
comes out, will be positioned at the underneath of the penile organ. So what happens is that can also lead to problems in consummation, or problems in conceiving also. So we have to do a proper thorough examination of the male. then
Yes.
then comes the biochemical and the semen analysis part.
Yes.
In the semen analysis, we have to do a proper semen analysis, where we look at the numbers of the sperms and the motility and the morphology of the sperm. Everything is done. If there are any problem in the sperm concentration, motility and morphology, then according to the problems that we notice, we ask them to come back for the next set of investigations, like the blood investigations, where we do the hormones and the routine tests, which includes their sugar parameters, their other parameters, vitamin D deficiency. These are all things which can affect male fertility also. Certain vitamin deficiencies, all these things are looked at. Only after looking at all these things, then we go to the next level, like genetic testing or other things.
Okay.
But some people, like, looking at them, we'll be able to know they are going to have some sort of genetic problem. For
Mhm.
example, if a male has not developed any mustache or beard or anything like that, even when they come at around 28 years or 30 years to us, then our antennae should be high. Okay,
Yeah.
something is abnormal,
Mhm.
that's why he has not developed something, uh,
Yes.
the secondary sexual characters in a proper way. So all
Yes.
these things depend on both the physical and the physical examination and the biochemical examination and the semen analysis, history taking, and then further testing like ultrasound, or these things are done little later.
Yes. I hope my viewers are taking a note on it. If they need to if they need to visit the doctor someday, they should note about the tests which are required for them to be done. Thank you so much, ma'am, for answering that question. As we have
Yeah,
limitation of time, I'll ask you a couple of more questions. Uh,
yeah, sure.
my I have to ask you about that. Can infections like mumps or STD can lead to permanent infertility in men?
Yeah, definitely, Ma. Like, especially we see lot of children who had mums at a young age, coming
Mm-hmm.
up with infertility at a later age. But a problem with mums is it can go unnoticed because we may not know. Like, some children might have, testicular pain or something like that at that point of time when they are having the infection. But
Mm-hmm.
some children may not even know that their mums or the any STI is affecting their testis.
Infertility.
It is so, as such, the viral infections, it's still a problem. The better is the prevention. Like, we have to teach
Mm-hmm.
children how to behave when they are in at school, how to be, how to prevent themselves from catching lot of infections from their friends, because
Yes.
children are very happy, and they enjoy well, and then they are together most of the time. So even common cold, like, mums doesn't have a big presentation sometimes. Like, it can have first start with cold, and then only it gives rise to a swelling of the salivary gland, or somewhere it is seen. uh,
Yes.
we have to be little careful. Anyway, now we have got good vaccination schedule,
Yep.
which is making it little lesser, actually.
True.
So parents should take it on their thing to vaccinate their children, and like, see their pediatricians regularly, so that they get their child vaccinated, especially as mumps, measles, chicken pox, all these things have got vaccines now. So these are all preventable, and you can go to the doctor at an early age. As soon as the child is born, you have to follow the vaccination schedule given by our government. And newer schedules are also coming up every year. It will be on our websites also, government websites, so you have to look at it and follow those vaccines. And STIs, the best thing is prevention, because
Yes.
sexually transmitted diseases can only be prevented. The
Yes.
promiscuity goes with STIs. So, as long as you are not promiscuous and you are careful in selecting your partners and being with mostly a limited partner or single partner, will prevent you from lot of issues that can lead to issues during your later life.
Yes, ma'am. Thank you so much for answering this
Yeah.
question, ma'am. I am going to ask you about the lifestyle and environment factors which are included in the male fertility, like how long a lifestyle change to positively affect the sperm health of the male.
Usually, it takes somewhere around 2 to 3 months. Any lifestyle changes that we give, for example, we will ask them to reduce their weight, their dietary changes, everything. Because what happens is sperm production happens regularly. Like, but what is the thing is, the sperm that is produced today, it
Yes.
has a period of going through a phase of maturity, and before ejaculation matures and then it is ejaculated. This period takes somewhere between around 65, 70 days to 74 days. So this time period is required for a change in the male body, to
Mhm.
imbibe the changes that are happening in the body and to sink in, and then the sperms that are formed after around 2 to 3 months will be able to have a better quality compared to what was there before 2 to 3 months or so. That's why we generally don't like brand anybody like azoospermia, spermic or oligozoospermic with one single like what to say, semen analysis or something like that. We generally ask them to come back after around 3 to 4 weeks for another analysis, or even after two analysis, if there is a problem, then we ask them to come for a third analysis also. So
Okay.
only after that we generally take a decision, okay, this is what is happening in the body, and then we have to treat the male accordingly.
Okay, ma'am. Thank you. Thank you for answering the question, ma'am. My last question to you will be, how can couples approach fertility challenges together, especially when male fertility is involved?
Yeah, as far as the male fertility is involved, nowadays there are a lot of treatment management. So the thing is, like for example, if it is very very minimal problem in the semen parameters or any issue that they are facing, especially even in the consummation or anything like that, all these can be addressed with medication, lifestyle changes, and proper counseling. These three will help them. But in problems which have little bit of severity, they have options like assisted reproductive techniques like intrauterine insemination, or in vitro fertilization, or ICSI. In vitro fertilization, they do ICSI also. These can be even in severe infertile couple, these can be taken into account. And for males, especially like azoospermic, we have got procedures like testicular sperm extraction, where the testis is under surgery, minor surgery.
Okay.
The testis can be visualized under microscope, which is called micro tease, visualized, and the tubules carrying the sperms can be taken out, and then look whether even one or two sperms can be obtained, so that the male can have his own progeny. So these are all newer options, and they are available almost for a decade or so now. And
Mm-hmm.
some more options are coming up, like stem cell and other things, which are all in nascent stage. But generally, good fertility clinic will be able to guide them through medicines and the ART procedures actually.
Okay, ma'am. So, these are some available treatment option also. We can say that, no?
Yeah.
Yes,
There
ma'am.
are treatment options because most of the couple would prefer to have their own child, right? Because where they want to be the biological
Yes, ma'am.
parents of a child born out of a wedlock. That is the thing. So for them, these are all the options that are available, and they can make use of the options actually.
Okay, ma'am. Okay.
Yeah,
So, ma'am, we are at the end of the session. Thank you so much for answering all the questions with so much of honesty and with care, ma'am. Thank you so much for
okay.
joining us today. So,
Yeah,
while concluding the program, thank you all for being the part of Do You. We hope today's session was very informative and valuable, spreading awareness on male fertility myths, facts, and treatment options. Our special thanks to Dr. E. Shanti for sharing her time, expertise, and insights with us today. For those who would like to visit the program, and the video will be available on our official social media platform. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Do like, share, spread the word as many, including your friends, family, and relatives. Until we meet in our next live talk, stay healthy and please take good care. Thank you so much, ma'am, again
yeah,
for
thank you so
joining
much.
us.
Thank you again, Human Biologicals and Satakshi. Thank you so much. And thank you, viewers, also for the interactive session. Thank you so much.
Okay, thank you so much, ma'am.
Yeah, bye.